Modern technology has come a long way. Just the last one.
Last 10, 15, yeah. Terrible.
Hey, good afternoon, folks. We are about ready to get started. And Congressman, I'm going to have to move this behind you. Good afternoon, folks. I wanted to introduce myself one more time. My name is Dave Herrero. I'm with the Coalition for Medicare Choices. We are incredibly lucky today to be here with Congressman Chris Gibson, who has joined us here for a discussion on Medicare Advantage. As a lot of you know, Congressman, we were having a brief discussion before you arrived about Medicare Advantage, and a lot of the folks in the room are on Medicare Advantage. Here in the state of New York, over 1 million people are on Medicare Advantage. Nationwide, it's about 15 million people. And the reason we're here today is for Congressman Gibson to hear from the folks who are actually on these plans and to hear about why this is an important program to you and how you've been using your Medicare Advantage in your everyday lives. The reason that's been important and the reason we are very appreciative of Congressman Gibson is that he has been a real champion for this program back in Congress. He has been fighting to preserve funding for the program and fighting to really stand up for it. And so this is an opportunity for him to hear from folks in the area and really hear your stories. So, Congressman, we wanted to just thank you again for being here. I know that we've also got a great group of folks from Silver Sneakers, and we'll look forward to hearing your stories, but I'll turn it over to you. And again, thank you.
Thank you so much.
Yeah, thank you.
Well, first of all, it's great to be back. It's good to see you. Always appreciate the opportunity. Well, listen, this is very personal for me too, just as it is for you. I mean, my mom is 77 years young, and so she is very reliant on her Social Security and her Medicare. And just as you heard from me last time, a couple of years ago, I said I was going to be the one to protect Social Security and Medicare, and I have fulfilled my pledges. You know, there were some that were trying to really adversely impact those programs, and I stood up to make sure that that did not happen. To protect and keep strong the Social Security and the Medicare. You know, we're here today and we're talking about Medicare Advantage, and I mean, to me, this is it's really about listening and being available for you in terms of choices. And if you think about what Medicare Advantage is really all about, it's about empowerment. It's about empowerment for you. So you have choices in terms of shaping, the program that you work so hard all of your years to have. And the results of Medicare Advantage, when you take a look at the numbers, right now almost 30% of the seniors in our country are on this program, and it continues to rise. The numbers continue when folks have the opportunity to make a choice in terms of how they want their Medicare program to work. More and more seniors are choosing Medicare Advantage, and the quality, the results of that are very strong. I'm not sure if it was mentioned earlier, but the overall satisfaction rate with Medicare Advantage is over 90%. And when you consider the fact that over 1 million folks in New York have this program, then I think it's really important that we keep it strong. So I appreciate getting this award here today for standing up strong for you and for my mom. And we'll tell you that I think this is going to be part of the future. It already is part of the present, but I think it's going to be part of the future going forward. I think it's worth noting that in a recent study, the viability of Medicare just increased by 3 years. And I think that there's a correlation between the increasing numbers of folks who are in Medicare Advantage and the viability of the overarching program. So, it's great to be with you today and tell you that, my office is not far away. I know that as I moved around and said hello to people today, we work cases for some of you, and we're available. We have Barb Palmer. I think some folks in the room probably know Barbara. And Barbara is a long-standing public servant who works very hard for us in the Kinnerook office. And likewise, we have Ann Muller. And Ann lives about, maybe about a 10-minute drive from this location right here, and is very involved in the casework as well. So I want you to know that your government is personal. I mean, it's right here. And I want you to know that we're responsive to your casework, and from a legislative standpoint, we'll continue to work hard to protect this program going forward. So with that said, I thank you. Thank you very much. Thank you.
So folks, we would love to turn it over to you and Congressman, for you to be able to have a dialogue now about Medicare Advantage and kind of share your stories. So thanks again.
Okay.
Thank you very much for lunch.
Yeah. Yes, please.
I'm on the Medicare Advantage now, and I received the silver sneakers. And since I've been going to the gym almost every day,
Wow.
I no longer have blood pressure, high blood pressure.
Yeah.
Yeah, I mean, hi Lisa.
That's awesome. So, you know, really the comment was made that because of, you know, you look at the choices and the program that's available, here we're talking about improving your own health, your own status of your health by continuing to improve or ramp up your physical activity, and there's been a direct correlation between that and your outcome. That's a great thing.
Yeah.
That's part of what we want to encourage with Medicare Advantage.
What is in danger of being cut?
So, you know, one of the things that the administration was looking to do was to cut the program. But the good news is this, is that in a bipartisan way, we stopped it. You know, there were Republicans and Democrats that worked together in the House and some in the Senate, and we wrote to the administration. And what we said is look, the results on this program are strong, and the satisfaction with the program continues to rise, and that these should not take place. And fortunately, the administration did listen. So we kept it strong.
I have Senior Blue, and I had a nurse and a dietitian call me on a weekly basis so that I wouldn't have to go out and pay a copay. My copay is $30. And they were very helpful in giving me hints on how to lower my blood pressure and my cholesterol. They followed up with me weekly, and it really has made a big difference. They also had a pharmacist call me and tell me alternate medicines that I should ask my physicians,
Yeah.
not such a high copay. So it really worked very well for me.
It's a great comment right here, and it's something we're actually seeing all the way across. And that is, you know, some investment on the front end on preventive and sustaining good quality health is actually helping save overall, save the taxpayer dollars too. Because, you know, when you have that sort of engagement from healthcare professionals, doctors and nurses reaching out and monitoring the status and providing some real-time feedback, what we're doing is we're ending up seeing fewer and fewer readmission rates into emergency rooms, which we know cost extensively. So just being smart on the front end, like we learned as kids, right? An ounce of prevention, right? You know, in terms of what positive impact that could be. Well, that's part of what the Medicare Advantage program is meant to facilitate, is this prevention on the front end. By the way, not just Medicare Advantage, but you're seeing it actually all across healthcare to try to make you know, wiser choices in terms of prevention, and then organize the providers in such a way, in accountable care organizations that help produce better outcomes at more efficient costs. Yeah.
Hi, I teach Silver Sneakers over at the YMCA. And I've been teaching it for about 2 years. And when I first started teaching, there was only about 15 people. Now there's about sometimes it's 27 different people, and it's because they see the benefit that they get, not just physically, but they get it because they're connected with other people. They make friends, they make lunch all the time, and you know, you have like a lot of people that just move from somewhere, they're making a friend, or they don't have, they go there, and everyone's very accepting. There's every different level that they come in, because some people have more active, or some people have different needs, and they're really accepting of whatever is going on. And, I've seen so many people being like, there's people that have just been coming in, and they told me their stories. Wasn't even able to tie my shoe, but now I can, or my blood pressure has gone down, and I don't have to take any medication anymore.
Yeah.
Or, just constantly keeping in touch with other people, so if they don't show up to class, they're missed.
Yeah.
And they ask, and so it's been a benefit, not just for them, but it spreads out throughout the YMCA, because other people see that and they realize it's such a good idea to do it that way.
Well, Lisa, thank you very much. The point was made that, through this physical activity as part of the program, we've seen a doubling of the numbers of the folks that are involved in the program, increasing the better health. And then also, there's a social component in this, right? We meet friends, and that's an important part of life too. And so, how about we give a thank you to the Y for this?
We would like to encourage any of you to come join the Y. And I know that some of you know better than I